You're watching CTOM TV. Knowledge is power.
Okay, we have a question from Phil. Phil has heard of something called Phoenix tears.
Phoenix tears, yes.
Which
Rick
is
Simpson.
that's right.
Yes.
And so he's wondering, do Phoenix tears treat cancer? And if so, how? If not, why not?
Well, these are common questions. We get a lot of people coming to us who've done either the Gerson or, the almond diet, or they're asking about DCA or, Phoenix tears or, CBD. Most of these things don't have solid scientific data that justifies their use.
Mm-hmm.
And if there is any, for example, with DCA, dichloroacetate, it's only in specific molecular cases,
Right.
specific cases, and it's based on molecular features. So as a consequence, Rick Simpson's, I forget what they're called.
Phoenix tears.
Phoenix tears, yes. They're supposed to be the CBDs and anti-inflammatory and so on. The data is just not there.
Mm-hmm.
It's just not there. We see so many people coming to us who've tried all of these things and it doesn't do a thing.
Well, but that's not the only reason why you're saying the data isn't there.
No, the data is just not there. Yeah, apart from
people
our own
have tried to
personal,
replicate
our own
this
personal learned experience. Yes.
Yeah.
Everyone does this. Now, of course, we do know that CBD oils from cannabis can be an effective treatment for certain children with epilepsy.
Is that what Phoenix tears are? Is CBD related?
I'm not sure if it's completely CBD. I'm assuming it is, because the CBD is really the supposed magical ingredient out of THC. I mean, it's all out of cannabinoids. There's also THC, which is pretty popular too, but for a very different reason. But as far as the cannabinoids, I mean, there's many cannabinoids, but CBD is the main one that is being purported to have all these anti-cancer benefits. So, it is an anti-inflammatory, but, so is broccoli. So is cauliflower, so is cabbage.
Right. Well, and there's a difference between helping to reduce inflammation and actually affecting the cancer cells and the development of cancer.
And, reducing inflammation goes so far.
Okay. So really, there's aside from this person's own personal
there's no
experience,
real scientific
there's anecdotal data at best.
Yes, people, personal claims and so on, but
Sure.
there's no real.
And there have been no replications in science.
There have been studies that they never went anywhere.
They didn't show, meaning to the people at home, you need to be clear about what you mean by never went.
Well, they
didn't show.
They never went
proof.
past preclinical,
because there wasn't any good
data.
reason to do it. Right.
Exactly.
Okay. So that's really the answer, is that people have looked into this and the science just
there has been a lot of research. Now, it doesn't mean that it's not going to go anywhere. I mean, I know there are some companies that are looking at certain cannabinoids and trying to alter them so they can be used in certain therapies like cancer therapy and so on. Haven't seen anything good yet.
Thank you for watching CTOM TV. Subscribe below and stay informed.